And good morning. I'm Dr. Deuk, July 31st, 2025. Our patient has back pain coming from his sacroiliac joint. And we're going to go in and treat the SI joint. Shot. Now, sacroiliac joint pain has been very difficult for doctors to cure over the years. However, we have developed a new way of treating sacroiliac joint pain called the Deuk plasma rhizotomy. And this involves basically going in and destroying the pain nerves to the joint. Unfortunately, he's got some bowel gas right in the way that makes it very difficult to see on the x-ray his sacrum. Jordan, you're going to need to do something. Let's rotate it a little bit. All right, that may be the best we can do. Go ahead and inject. Let's see what we got, Sean. Try to get a straight AP because I got to see my angle. All right, I think that's probably as good as I'm going to get. Maybe I'll go a little bit higher right here. Sean? A little bit right there. Go ahead. All right, we're going to make an incision. The incision is 4 millimeters. We're treating the SI joint. Is he moving?
No.
You sure?
Yeah. No. It's just
Yeah. I understand. So, Henry, let's show the audience how the SI joint can be so painful in some patients.
Sacroiliac joint injury is a common cause of chronic back pain. The inflamed sacroiliac capsule tear generates pain signals. The best treatment for sacroiliac joint pain is the Deuk plasma rhizotomy. Sacroiliac joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
Welcome back. You can see on the x-ray we're using a lateral view to verify position. Now this patient is really large. Take your time, Jordan. Unfortunately, back pain causes people to gain weight. A lot of people think, oh, they have back pain because they're fat. No, they're fat because they have back pain. And that's because they can't exercise. They're unable to get out and do exercise. Sean? So they end up just laying around. Unfortunately suffering. All right, so I'm actually pretty happy with that right there. I used the lateral view to verify that we did not go past the back of the sacrum, which we did not. This sacrum is so anterior. I mean, you can see I'm touching the bone, and that's where you want to be to do this procedure. But it's the deepest I've ever gone. But we are posterior, and that's what matters. But so far, so good. Let's show the audience how we do this procedure to denervate the sacroiliac joint and get rid of sacroiliac joint pain. in that case. Yeah, his ischium is coming over. Nope. We're fine. This is on a scale of 1 to 10. This is going to be a 10. But I am getting done what I want to get done. It seems to be working. Shot? Just not sure why. Any questions?
At this moment, no current questions.
All right, I've already made 2 passes. I'm going to do 1 more pass just to be sure we did everything we can do for him, because he's in so much pain and I feel really bad for him. I want him to have a great result here. Sean? That's really right where the L5 dorsal ramus is. All right, I'm going to do this last pass. And then we should be done. All right, let's hope we got it.
Sitting on, please. Thank you.
Folks, you can see 4 millimeter incision. Right there, you see that, Henry?
Yes, we do.
All right, let's go ahead and show the audience one of our past patients that had this done, and then we'll end the stream. We'll be back for a thoracic Deuk laser disc repair. Thoracic disc herniation and pain. And good morning, I'm Dr. Deuk, CEO and founder at Deuk Spine Institute here. I have a patient who came to us with severe, debilitating pain coming from below his spinal fusion in his lower back. He had sacroiliac joint pain on both sides, and there was no getting rid of it. There's only one treatment that works, and it's the Deuk plasma rhizotomy, offered here at Deuk Spine. It's now patented and it's FDA approved. His insurance approved the procedure. He had it done yesterday. How do you feel today?
Great. That 99% better than I felt 2 days ago. Not kidding you.
And are you on pain meds?
No, I'm not.
Did we put you on some new meds that took away your pain, or is this from the procedure we did?
This is from the procedure.
And we did it less than 24 hours ago. Here you are back here. It was outpatient. Your pain is gone. You're not on any medication. There was no bleeding, no hospitalization necessary, and 2 tiny little 4 millimeter punctures on the skin. You happy?
Oh, absolutely. I'll give you a kiss if I liked you.
You like me.
I
You
know,
already
I
gave me
know.
a hug.
I
But
know.
kisses are off limits. My wife is the only one. My kids. That said, I've known you for a long time.
Oh,
We did your fusion many years ago. Because of the fusion, you wore down those SI joints pretty quick. So that's why we had to do your procedure. Very common in patients with fusions in their backs, they get what's called adjacent segment disease. And what that means is when you fuse a part of your spine that's meant to be bending and twisting, then that puts strain on other joints above and below, and they wear out faster. We do not recommend fusions on anybody, or laminectomies or discectomies, because they lead to fusion. We did your fusion many years ago.
oh yes.
Your insurance did not want to do the laser. They only wanted to do the fusion, so we did it. And now we're dealing with some of the sequelae of that, right?
Yeah, workman's comp was tough.
And people say work comp patients don't get better. Is that true?
Oh no, depending on what doctor you have.
That's right. And what treatment you have.
Yeah, absolutely.
If you have the right treatment, work comp patients get better. Isn't that true?
That is absolutely true.
Is there anything you want to tell your fans out there?
I'd like to start out by telling you in 1982 is when I first had this situation happen during a 5-car accident. And I've been living with pain forever, seemed like. Today I don't have any pain. I mean, I just don't feel any pain. That's how far I've come, along with this man, of course. Without him, I don't know what I'd have done or what I've done. One nurse one time gave me go see Dr. Deuk. He's the best. Well, he is the best. Thank you.
You are why I do what I do, to
Thank
help
you.
people just like you suffering, to try to give you some decency and quality back to your life.
Even all the complaining, I said, I don't want it, I don't want it, I don't want it. You kept talking me into it. I'm glad you did.
You're
I'm
welcome,
glad
my
you
friend.
did.
You're welcome. Enjoy your life.
Oh, I will. And you too, huh?
Thank you.
You're a good guy.
Thank you. I appreciate it. All right, let's get you out of here.